Tonight. It's great to have so many of you here in person. It's also fantastic to have so many of you joining us online via the live stream. I would like to formally welcome you to the Faculty of Health and Medical Sciences, Dentistry and Oral Health Admissions Information Session. My name is Sasha Champion. I am a student recruitment coordinator in the domestic recruitment team here at the University of Adelaide, and it is my pleasure to be your host and your MC this evening. Before we dive into things, I would like to do an acknowledgement of country, to acknowledge and pay our respects to the Kaurna people, the traditional custodians whose ancestral lands we gather on tonight. We acknowledge the deep feelings of attachment and relationship of the Kaurna people to country, and we respect and value their past, present and ongoing connection to the land and cultural beliefs. So just a couple of quick housekeeping things before we really get into it. If you do need the bathroom at any point this evening, they are just located just through the doors down the front here and then around to the left. In terms of the format of tonight, I will very shortly be inviting up our first speaker for this evening. We're very, very lucky to be joined by Associate Professor Dentistry, who is the Bachelor of Dental Surgery Program Director for the first 3 years, years 1 to 3. I'll also shortly be inviting up Dr. Jennifer Gray, who is the Program Director for the Bachelor of Oral Health. And they will speak to you to sort of talk to the structure of the Bachelor of Dental Surgery and the Bachelor of Oral Health, respectively, the sort of key components of the degrees of study experience. I will then jump back in and talk about the key pieces of admissions information that you need to know as a possible applicant. And then we will go into our Q&A. So I just ask that if you do have any questions at any point this evening, that you hold those questions until the Q&A. And at that point, if you have a question, you just simply can pop up your hand, and we have a roving microphone that will make its way to you. If you are joining us online, we just ask that you pop any questions in the chat function. Joining Associate Professor Dimitri Lekis and Dr. Jennifer Gray and myself on the panel, we are very lucky to be joined by 3 current dental surgery students who are all in slightly different years of the program. So we have Valerie Jung, who's a 3rd year student, Isabel Tran, who's 4th year, and Samantha Tang, who is in a 5th and final year of the program. So they will be up on the panel to help answer all of your questions as well. So without further ado, I'd like to invite Dimi up to the microphone to talk about the dental surgery program. I'll leave that there and I'll take that away.
Okay, so welcome everyone. First I'd just like to introduce you to the Adelaide Dental School. So we're the only dental school in South Australia, and we've got 2 what we call undergraduate programs. One is the Bachelor of Dental Surgery and the other is the Bachelor of Oral Health. We've been around for 100 years plus. And we'll talk about this, both Jen and I, so we won't repeat too much on this slide. We'll tell you a little bit about our courses, where we can tell you about our facilities. So a lot of our clinical placements are situated in the Adelaide Health and Medical Sciences building, which is down on North Terrace near the Royal Adelaide Hospital. We have on main campus, so if you come to open day, hopefully you can get to tour the dental simulation clinic. So it's not too far from this building. And both our dental and oral health students spend a lot of time there learning all their basic skills before they can then practice on patients. And then we also do simulation parallel to clinical practice as well. And both our programs, Jen and I will sort of explain that that both our programs are very hands-on. So you do get clinical practice experience from the beginning of first year right through the whole degree. And then both programs, our students experience, like as they progress through from first year towards the final years, lots of different types of clinical placements, and one of them we'll talk about is community outreach program. And in both our programs, we'll let you know that unlike medicine, where you have to do an internship, both a student who graduates from the dental surgery program and oral health program are fully qualified and able to practice immediately after they get registered in Australia. So we'll talk a little bit about careers as well. We mentioned our facility, so that's a little picture there of our mannequins in the dental simulation clinic. And if you tour there, we've got a little tooth vending machine. So instead of, food vending machine, we've got like a tooth vending machine. And they do simulate very closely to real clinical practice. And am I going? Yep, in the right direction. So this is our dean. So he sends his apologies, but it's Professor Richard Logan, myself, and Professor Yankin is the program director for dental surgery years 4 to 5, and and Jen, who's going to talk about the BOH program. Okay, so the dental surgery program is a 5-year full-time degree, and I'll talk in terms of like a little bit about its structure. So as I mentioned, once students graduate, they're fully qualified to do the full scope of a general dentist. It's a very hands-on course, and it's what we also call a highly integrated curriculum. So that means in dentistry, it's quite unique here, we have one subject in each year level. So we integrate our sciences with our clinical practice. So students learn to think and act and be like dentists, but also underpinning that are all the biological sciences, behavioural science, evidence-based dentistry, person-centred clinical communication skills, general medicine, and a whole range of other science subjects in conjunction with clinical practice. So we try to integrate everything. And sort of across our 5 years, we start off with our students learning the basics, so sort of about human health and healthy body. And then as they progress from first year to final year, they'll learn more about sort of diseases and oral diseases and general diseases that affect not just the oral cavity only, but the whole body and how that impacts on oral health. And so they learn from simple to like more complex sort of clinical patient management as they progress. And same with the way we sort of deliver our lecture content, or our curriculum content, I should say. We have combinations of online learning, face-to-face simulation, clinical practice, as well as what we call small group discovery or case-based learning. So our students learn how to work in small teams, and this tries to replicate what they're going to experience when they're in clinic. Because dentistry is a teams-based profession, like oral health and all the dental specialties. We work in teams of a range of health and dental professionals, and students need to be competent not just with their skills, but with communication skills, teamwork, time management, and be actually very good communicators. And so we prepare our students and we scaffold them across each of the year levels, building up on their knowledge and skills as they progress. As I mentioned, we start clinic on each other in first year. So students work in small teams and they learn the role of a dentist, dental assistant and a patient, and they rotate around like that in the clinic. In second year, they progress to seeing simple family and friend patients. And then once they get to third year, they'll start to see members of the public. And so they do invasive dental procedures from checkups to fillings and scaling, and then and giving local anaesthesia. So it actually is real clinical practice under direct supervision of a tutor. So we have, again, small groups in clinic working under the supervision of a qualified practitioner. And then as we progress from third year to final year, the procedures and the students learn about become more complex. And in dentistry, we do the full range of clinical procedures and holistic patient care and treatment planning. So our students, by the time they graduate, are able to do from simple sort of dentistry right to complex extractions, crowns, root canal treatment, dentures, but also sort of managing patients across the whole age spectrum, from healthy patients to patients with multiple medical conditions as well. So that's just a real quick overview of our program. And then in final year, our students spend a lot of time in clinical placements, and we have placements here in Adelaide, metropolitan Adelaide, rural South Australia, and interstate. So yeah, it's a very, very clinical course that progresses from a couple of hours a week in clinic in first year to many hours in fifth year, depending on where the students are placed. And dentistry is a very flexible sort of career. It's a very rewarding career. You can work full-time, part-time. Most of our graduates will are employed after graduation, mostly in private practice, but certainly some of them work in public practice. And there's a few that enter later on, maybe early on or later on in their careers, in either research or academia, So I started off as a general dentist in practice, and then I switched careers to like a full-time academic. And certainly then there's also opportunities for further study as dental specialists in a whole range of specialty areas. So I'll hand over to Jen now, and she'll let you know a little bit about our Bachelor of Oral Health program.
Thanks, Dimmy. So welcome. Great to get a chance to be here and to have a talk about our program. It's a program that's been within the dental school for the last 20 odd years, and we've seen changes over that time, and it's constantly changing and growing as the profession is. It is something that sits alongside the dental surgery program, and as Dimmy said, we work very closely together and the students work closely together. It is a team environment as students, it's also a team environment in practice. There are lots of opportunities for working in that small group environment, so we tend to have about 30 students in each cohort. And so it is great, you really get a nice group of students working together, working collaboratively, and they often retain those friendships throughout their career. They spend a lot of time together as students, working in those small groups, and they do maintain those. So it is a very supportive environment, small group of students, small group of academics that you get a lot of input on a variety of factors. You get to work within the simulation clinic right from the first year. So you're starting that hands-on, going into simulation clinic, going into clinic, and that's all then supported by the underpinning knowledge that you get within the first year. We do have extensive placements, and they start from second year. You start out in the community clinics. We tend to use a lot in second year of the Elizabeth and the Marion dental clinics, where you spend a couple of days a week, and then leading on to third year where you might be across those clinics plus some additional where you spend about 3 days a week in clinic. One of the unique aspects for our program of any of the oral health programs across Australia is that we have a research project in our final year of the program. Believe that it's really important to have that underpinning research because we are constantly learning. Oral health has evolved over years, and it's good to be a part of that and contribute to that research. So it's an opportunity that we support from the undergraduate. So you'll start on some projects within year 2, and then you get to do an oral health elective in year 3. And we do have a number of our graduates that go on to do honours and to do PhDs as a result of that research. It's critical because that's what we do as a practitioner every day. We are looking at research, we're reviewing research, and we can also contribute to that because information just changes so quickly. Dentistry, when I started, was quite different. We don't even use those materials anymore. So we constantly have to keep up to date with what is new research, what are new materials that we need to implement into practice. So research is critical. We also provide a lot of care to the community, and that includes paediatric with the children, adults, but also special needs groups, working within special needs, working in the community outreach, and into some of the schools and doing special health promotion campaigns as well. So this is an overview of the structure of the 3 years of the program. The first year is very much an introductory, introducing all of the basic sciences that you need to underpin a lot of your knowledge, so that you look at some of the sciences, the health sciences, the dental sciences that underpin that information, looking at the diseases that you experience within the oral cavity, whether that's gum diseases, whether that's tooth diseases, exploring how they actually work and then how we can look at restoring some of that. But most importantly, preventive. We have very much a preventive focus in what we do within the oral health program. We also want to look at how we work together as patient and provider. So for us as clinicians, it's really good to actually be the patient. Many of our students have never had a filling done, and that's far more common now. So it's good for them to actually be a patient within that environment, and also suddenly to have to look at how do we provide that care. We don't do anything invasive. We don't just suddenly cut teeth because we want to practice. So we look at anything that's not invasive in first year in providing that care. And we spend a lot of time really developing those skills within the simulation clinic, as well as in the clinic for anything that's non-invasive. For the second year, we spend a lot more time in the simulation clinic. You have a couple of sessions there where you're really working on your plastic teeth and experimenting with all of the different cavity designs and restoring those. And then that's supported by 2 days a week within the clinic, working on children on one of the days and then adults on the other day across a range of different procedures, supported by tutors within that environment. So we don't just throw you in, we want to have a very close tutoring relationship with you as you develop those skills across the year. We also look at developing that deeper biological sciences, particularly around the medications, medical conditions that a lot of your patients might have that might impact on their oral health and the way that we can provide care. Looking at potentially interactions of medications that might interact with what we might want to do as part of our procedures. So need to extend that understanding of the sciences within second year. We also explore a lot of the social sciences, so looking at disease processes and what are the variety of factors that impact on diseases for children, adolescents, special groups, special needs groups that might have different needs, and how that might impact on their health and on their oral health. That's also where we look at the evidence-based dentistry and understanding diseases and how it impacts on the community, and therefore how we can help with that and reduce the burden of disease. In the third year, that is heavily clinic-based, so you actually are in clinic for up to about 48 weeks of the year, providing care about 3 days a week. And so you would have a day where you're working with the paediatric group, a day where you're working with adults on more perio-based care, and then the third day that you'd be spending on extended adult care where you might be doing examinations, treatment planning, restorations for adults. You also have an opportunity to do some placements within special needs, potentially in rural areas, and doing some health promotion activities. And then alongside that, we look at the Oral Health Research Project as part of that final year. And you get to present that research that you've done to other cohorts, to the first year, second year, and to the colleagues within third year. And many of our graduates then often present at conferences or write a research paper that gets published in journals as a result of that research that they do. So career opportunities that you have, most of our graduates work within a general practice and provide a wide range of care across both paediatric and the adult. There are some of our graduates that actually end up owning their own practice and employing other oral health therapists, dentists, specialists as part of that. So working in public sector as well as in private sector. There are a number of graduates that go on for further study, whether honours, PhDs, and then moving into the area of research, which is an exciting opportunity that we have. People will work within government sector as well, where they've got an opportunity to work across a range of different aspects. And I think that's the end of me, so I will hand over.
Thank you so much for that. Yes, so that was a really fantastic overview. Both the Bachelor of Dental Surgery and the Bachelor of Oral Health. So what I'm going to do now is take you through some of the more meaty bits of information. We're going to look at Just the key things that you need to be aware of, requirements, pathways, dates, the timeline and things like that. Just everything you need to know as an applicant. This is a nice sort of table to start off with. What I'll do is I'll talk about the Bachelor of Dental Surgery and the Bachelor of Oral Health sort of alongside each other. There are some similarities in terms of the admissions process, and there are some very important differences to be aware of as well. So again, nice summary table. I'm going to start off with the Bachelor of Dental Surgery. So as you can see, we have one intake every year at the start of every year only. There is a minimum academic score that we need you to meet if you're looking for a place. So regardless of whether you are seen as a domestic student looking for a domestic place in the program or an international student looking for an international place in the program, the minimum academic score requirements are the same, as you can see. So if you're working towards an ATAR in year 12, you need a minimum of a 90 or above to be eligible. It's not a guaranteed score, it's an eligibility score, 90 or above. If you're working towards your International Baccalaureate or your IB, you need a score of a 34 to be eligible. If you are considered an international student, you do have to show that you meet a minimum English language standard, and one of the ways that you can do that is through a test called the IELTS test. It's an international English language standard test, and if you do the IELTS test, you need a score of 7. Duration, Jimmy's already talked about that. It's a 5-year program. If you study at a full-time pace as a full-time student, 5 years in the program. Prerequisites, there are prerequisites that you need to be aware of. So prerequisites, subjects that you have to have done in year 12 in order to be eligible for a place in the program. So for the Bachelor of Dental Surgery, there are 2 different categories of prerequisite subjects, and you need to make sure that you have got at least one subject from each category to meet the requirements. So the first category, you're looking at one subject from either chemistry, physics, maths methods, or specialist maths. The other category, one subject, biology, chemistry, earth and environmental science, or physics. So again, it's just minimum of one subject from each of those categories. Looking at the Bachelor of Oral Health, similarly, one intake every year at the start of every year. There is also a minimum academic score that you need to meet. It's a little bit different to dentistry. So again, if you're working towards your ATAR, your selection rank, it's a minimum of 70 or above to be eligible. If you're working towards your International Baccalaureate, it's 25 or above. Similarly, the IELTS test score is the same, looking for a score of 7. We already talked about the duration. It's a 3-year program as a full-time student. And prerequisites are a little bit different. You've got a little bit more flexibility in terms of prerequisites for the Bachelor of Oral Health. So you can see we're just looking for you to have done one subject in year 12 that falls under the mathematics or sciences learning area. So again, you've got a lot of flexibility with that, but you just need to make sure one of your subjects in year 12 falls into that category. So this is, I would say, a timeline, a visual sort of timeline that represents what your year in year 12 will look like from the perspective of a domestic student, a domestic applicant. So this kind of follows from the start of the year right through to the end of the year, what you need to be aware of at different points in the year. And again, I'm going to talk about dentistry and oral health alongside each other and then point out the differences where they lie. The first step that you need to be aware of are those prerequisite subjects. We put that first because you need to be making sure that you're doing everything in the earlier years before year 12, or year 9, year 10, year 11, doing everything that you need to do to make sure that you are able to complete those prerequisite subjects in year 12. So if you're looking at something like chemistry, for example, just as an example, you'll often will have to do chemistry in the earlier years. You'll have to pick chemistry in year 10 and year 11 in order to be eligible to do it as a year 12 subject. So again, making sure that you're aware of them. When subject selection time comes, you're picking the right subjects to give you that option in year 12. Academic score is also put very early in the timeline. You won't necessarily, you won't receive your academic score until right at the end of year 12, but we put it right at the start because it does need to be at the forefront of your mind pretty much from day 1 of year 12. So again, doing everything that you can, doing everything that you need to make sure that you meet those minimum academic scores. The UCAT is the next step. So the UCAT is a formal part of the application. It's a required part of the application process for both the Bachelor of Dental Surgery and the Bachelor of Oral Health. So you'll need to register for the UCAT and you'll need to sit the UCAT in year 12. There is a testing window, so a period of time where you can sit the UCAT every every year. There's a couple of different dates that you can choose from depending on what suits you best. We're sort of approaching the middle of the year now, sort of around this time. This is sort of around where students will register for and then sit the UCAT. So we're approaching sort of middle of the year. Once you've done the UCAT, once you've sat the UCAT, you've got your score, the next step is to actually apply to study either the Bachelor of Dental Surgery or the Bachelor of Oral Health, and you will do that through SATAC, which is the South Australian Tertiary Admission Centre. So that's your opportunity to essentially communicate to us that you would like to be considered for a place in either the Bachelor of Dental Surgery or the Bachelor of Oral Health. Once you have applied, there is a closing date. We close applications for both the Bachelor of Dental Surgery and the Bachelor of Oral Health at a certain date. I'll talk about specific dates in a moment. But once that date passes, we then need to do some analysis to determine who will progress, of all the applicants, who will progress to the next stage, which is the interviews. So you will be advised of your interview eligibility outcome. If you have received an interview, you're advised via email. And then the next step is for you to actually sit your interview, and now we are right at the end of the year. So interviews always happen sort of from late November through till December, after your final exams in Year 12. Somewhere around that period, again, there's different dates that if you do receive an interview, different dates that you can select from to sort of sit and have your interview. And once you've done that, we're right at the end of sort of December now, and we have access to everything that we need to look at to determine ultimately who will be given an offer. So I'm going to break it down even further now and go into even more detail again, just to make sure that giving you as much information as we possibly can on all of these steps. So again, prerequisite subjects, they're different. Bachelor of Dental Surgery, you need to make sure you've got one subject from those two different categories, at least one subject. Oral Health, again, you've got a little bit more flexibility. You want to just make sure at least one of your subjects in Year 12 falls into that mathematics or sciences learning area. And again, with dental surgery, obviously there's, and with oral health, there's flexibility there, like you've got choice. I suppose you don't necessarily have to look at doing, you can't necessarily do all of those subjects, but just make sure that you are doing at least one from each of those categories or one for oral health from under the mathematics and sciences learning area. It's from our perspective, it's just a tick box situation. Have you met those requirements? Yes, your application is progressed. Academic score, again, making sure that you are doing everything that you can. This is right, very aware of this in Year 12, doing everything that you can to make your score as competitive as possible. So again, if you're working towards that ATAR or selection rank score of 90 or above, oral health 70 or above, and you will note there for dentistry and oral health it does say that score includes any adjustment factors that you are eligible for. So if you don't know what I mean when I say adjustment factors, that's okay. Adjustment factors are essentially additional points that you can be awarded in Year 12 that will go towards your ATAR. Your raw ATAR is added together with any of these adjustment factors or adjustment points, and it gives you what's called a selection rank. So there are two different types of adjustment factors. There are what's called subject-based adjustment factors or subject points. These are awarded to you if you do certain subjects in Year 12. You can be awarded additional points based on the completion of those subjects. The other category is called equity-based adjustment factors or equity-based points, and they are awarded to students based on your personal circumstances. So that score of 90, that score of 70 does include any of those that you are eligible for that apply to you. The UCAT, so again, you do have to sit the UCAT in Year 12, you have to register for the UCAT. I'll talk about, you can actually see there, it's right there. There is a certain date that you do have to register to sit the UCAT by. If you are not in Year 12, if you are perhaps in Year 10 or Year 11, just use these dates as a bit of a guide, because typically they can change a little bit here and there between admissions years. So if you are currently in Year 12, these dates are obviously relevant to you. So you need to have registered to sit the UCAT by this year. It's Friday the 17th of May, which is next Friday. If you want to avoid a pretty hefty late fee, make sure, again, if you are in Year 12, you haven't registered for the UCAT, go home tonight, register for it, pay for it, it's done, it's out of your hair, you don't have to worry about it. Make sure, again, you're aware of that. And then, like I said, you've got a bit of a window, a window. You have a little bit of time to choose, the date, and you'll sit the UCAT at the date that you've chosen. And then, as you can actually see, the testing period is from the 1st of July through to the 9th of August this year. So you've got a little bit of time, a bit of a window. Once that has passed, SATEC applications, again, will open. You've done the UCAT, SATEC applications open. You then, like I said, communicate to us that you want to be considered for a place in these programs. So you can see we've actually listed for you there the 2 different SATEC codes that both the Bachelor of Dental Surgery and the Bachelor of Oral Health have. So if you are in Year 12, you're probably going to be quite familiar with how the SATEC application process works, or you're coming to be familiar with how it all works. So essentially with SATEC, when you apply, you are given 6 spots. They're called preferences, 6 different preferences, which are essentially your 6 spots for you to list the 6 degrees that you are interested in studying, that you would like to apply for. It's essentially your 6 preferred degrees that you would like to study, you would like a place in. So every single degree will have a SATEC code that you will need to list in those preferences. So we've listed them for you there. Obviously, Bachelor of Dental Surgery, Bachelor of Oral Health have 2 different SATEC codes that you will list. The next step, interview eligibility. So again, SATEC applications will close. We assess then who is eligible for the interview. And the way that we do that is we just look at your UCAT score. That's the only thing that we're looking at that point to determine whether you progress through to be given an interview. So as you can see, for the Bachelor of Dental Surgery, we're looking at taking approximately 300. So it's essentially the top 300 UCAT scores from that year's applicants, and we progress them through to the interview. For oral health, we're looking at approximately 90, the top 90 UCAT scores, and progressing them through to the interview. Tuesday the 24th of October is the date this year, the interview eligibility outcome date. So again, if you're in Year 12 this year, make sure you're checking your emails on this date to see whether you have been given an interview. We have one interview period. We have one round of interviews. Like I said, sort of end of November through to December. And really important to note, whether you are based here in South Australia or whether you're based interstate, interviews will be held online via video conferencing. Then, again, we're right at the end now, interviews are done. Now we need to look at everything to determine who ultimately gets an offer. And this sort of weighting system applies to both the Bachelor of Dental Surgery and the Bachelor of Oral Health. So again, it's in December, your academic scores have been released, we've seen you in the interview, and we've seen your UCAT score. So again, we applied slightly different weighting to those 3 things to consider them and consider you as an applicant and who gets made an offer. So 20% goes towards your UCAT score, 40% is based on your performance in the interview, and 40% is your overall academic score. And then you'll be notified the following year, early January the following year. So for this year's applicants, you're looking at January 2025 to determine essentially who gets made an offer. So in terms of specific dates, the next date to be aware of is that UCAT closing date, Friday the 17th of May. Again, if you want to avoid any unnecessary late fees, I'm giving you the opportunity to avoid it now. Go home, register for the UCAT now. That testing window for the UCAT, you've got the 1st of July through to the 9th of August. This year, SATEC applications open on Monday the 5th of August, so it's actually technically within that UCAT testing, right at the end of that UCAT testing period. But from Monday the 5th of August, SATEC applications will be open. You can go in, do your application. Another really, really important date to be aware of is the next date, Monday the 30th of September. That is the closing date for SATEC applications for both the Bachelor of Dental Surgery and the Bachelor of Oral Health. This is a hard closing date, hard closure date. We cannot accept applications for the Bachelor of Dental Surgery or the Bachelor of Oral Health after this date. So if you try to log into SATEC and enter the Bachelor of Dental Surgery or the Bachelor of Oral Health, if you try to put it in your preferences after the 30th, you simply will not be able to. We like I said, we do not consider applications made after this date. So please make sure that you remember this date. Please make sure that these degrees are in your preferences by this date, and also really important, please make sure that you've paid for your SATEC application by this date as well. The 24th of October, again, that's your interview eligibility outcome date, so checking your emails to see whether you've been given an interview. From late November, we've got that interview period. Interviews will be held and then offers released from early January. So I suppose what I just wanted to talk about here is possible alternate. I know that was a lot of information in quite a short space of time, but as you can probably see, this is it's a non-standard admissions process, both of these degrees, and it is competitive. There's a certain number of places that we offer in these both of these programs every year, so it is natural to think about possible alternate options, to look at what other pathways could I look at if there are lots of other ways that you can contribute to the healthcare sector, outside of dental surgery and oral health. So some other programs that you might want to consider if for whatever reason you're not successful in getting a place in either dental surgery or oral health. We have a Bachelor of Health and Medical Sciences, which is a really fantastic program. We have our allied health programs, physiotherapy, OT, speech pathology, and we have a great nursing program as well. So again, all fantastic options to consider, depending on what is right for you. So everything that I just said, everything that I just blurted out at you in a very short space of time is written down for you in our admissions guide. So I recommend scanning that QR code, making note of that website, even if you just Google University of Adelaide Dentistry Admissions Guide, University of Adelaide Oral Health Admissions Guide. It's all written down for you. This is the best place to go to if you're looking for, as you can see, information on the program as a whole, if you're looking for key dates, pathways, the general overview of the application process. And if for whatever reason something were to change to the application process, this is where it will be. This is the first place that it will be updated. So a really, really important document to make note of, to flag. And if you're not in year 12, still recommend that you go through this and read through it, making sure that you're checking in with this document at multiple points in your education journey. Again, just making sure that you're aware of anything that you need to be aware of at each point. Open Day, I will just flag this as well. Open Day is a fantastic event that we do every single year. This year it's Sunday the 11th of August. All of the amazing facilities that you heard us talk about, that our dental students and our oral health students get to work in and study in every single day, they will be open on Open Day. So you'll get to see it, you'll get to chat to possible academics and possible teachers that will be teaching you in the program. You can chat to current students that are currently in the program to hear what their experience is like. It's a really, really great way for you to sort of visualise what your experience will be like here at the University of Adelaide, what your life will be like as a dental student or an oral health student. And if you do register for Open Day via that QR code in the corner, you go in the running to win one of 3 $1,000 gift cards, which is a pretty cool incentive. So what I'm going to do now is invite my lovely panel members up to the stage to take a seat. And as they're doing this, I'll just sort of communicate the way that this is going to work. So again, if you do have a question, anything that we've been talking about that you sort of want to know more about, I've just asked that you simply pop up your hand, and we have, like I said, a roving microphone that will make its way to you. We're going to look at general admissions questions if you have questions about the student experience, you want to know more about the facilities, that sort of thing. If you do have questions that maybe more specifically relate to you, more specific questions about you and your pathway, what we'd actually recommend is you chat to our future student inquiries team. You can get in touch with them via the details on the screen. They can help you with those more complex questions. But any other sort of general questions, we are very, very happy to answer now. So again, simply just ask that you raise your hand if you have any questions, as you're maybe thinking, oh no, one at the back, go for it.
Hi again, I have a question regarding any pathway between the oral health bachelor and for the graduate oral health bachelor to the dentistry bachelor?
Sure.
Yeah.
Sure. I don't know, do you want to talk about whether that, yeah.
Thank you.
Yeah, good question. There's actually not a direct pathway between the two programs. They have similarities, but also are different and really quite sort of separate to each other. So we do have people that will start within the oral health program, and then if they are successful at a later date getting into the dental surgery program, they start from year 1.
And the admissions is from beginning again, so they will have to apply through that same step process that was described before. So UCAT, and then depending on the eligibility for offer for interview and so forth.
The other thing that I'll just flag, if you're looking to use that pathway, like you heard, the process is very much the same. One of the key differences is instead of looking at your academic score that you've received at school, like your ATAR or your IB score, we look at what's called your GPA, your grade point average. So that's a score that summarises your performance at university. So that's a key difference to be aware of as well.
So both our programs have, for domestic pathway, school leavers, so both school leavers can apply, or students who've done tertiary education. And they don't have to complete the full degree. They can, start year 1 in a degree and then apply, or complete a complete degree. So we do have a mixture of domestic students in the BDS program. Most of we have students from South Australia as well as students from interstate in the domestic pathway.
In the same way, we also have students that have either completed or started a health sciences degree, that maybe they weren't successful in getting in either program initially, but did some study and then went through the whole admissions process again and were successful and entered into either of the programs. So those opportunities are there, but as Jimmy said, you need to meet all of the admissions criteria.
Hopefully that helps answer the question. Just got a question up the front. As Steve runs as fast as he can. Thank you. Don't be shy.
Through the interviews, it ranging from 300 to 90 interviews, how many people would actually get into the university?
That's a really good question. I might just have a go answering this, and if you want to, you're more than welcome to jump in. This information is actually in our admissions guide. So from the 300-ish that we will interview for the Bachelor of Dental Surgery, there's if you look, I'm looking at domestic places. It's about roughly, give or take, 54 domestic places available. So again, from 300 down to 54, oral health is smaller. You heard it's 30, yes. You heard say that before. Oh, sorry.
We've got, if you check the admissions guide, the actual numbers for both the programs are listed.
Oh, sorry. Yes. Okay. So perhaps check the admissions guide first. And like I said, it's actually listed there. But again, that's looking at domestic students. I think that you can look at, if you want to know, there's an international student admissions guide as well that tells you the international student places. But as you heard, like the reason that it's the difference where, it's a relatively small cohort, but that's so we can increase that level of support that you get, the interaction that you get between the staff, your teachers is really high. So again, it seems small, it sounds overwhelming, it sounds competitive, but there's a reason for that. So admissions guide. Sorry, thank you.
Whilst it's competitive, so you can, so there's a large number of applicants, to both programs, and then we interview a certain proportion, and then there's a final sort of cohort. And it's also because they're both clinical-based programs, and they need clinical placements.
Yes.
And so that's why, and to be able to supervise students in small groups, that's why it's a small cohort as well.
It's a very good question though. Thank you. Hello, down the front. Oh, two, sorry. Yeah, all good. We can come to you.
I have a question regarding the interview. Do you have any advices on how to excel the interview? Like in terms of the key values that the interviewers actually look out for to be able to distinguish potential dentistry students?
I'll start with that, and then the students can maybe talk about their experience. But everything is on the admissions guide. So if Sasha goes back to the screen, if you do the QR code, the admission criteria are listed there. So this is the same, the criteria for medicine, dentistry, and oral health.
Like the interview process.
Yeah,
yeah.
It's well described. Yeah, not the questions, but the criteria.
It's all listed there.
Oh yeah, because I wanted to ask the dentistry students like how were they able to like answer them well. Thank you.
So the interview I found was actually very, very straightforward. They're not here to trick you. They just want to see if you would be good as a dentist or a dental student, essentially. So you really just have to ask yourself, like, why do you want to be a dentist? What qualities do you have that a dentist would have, that you would enjoy or you'd be good at? So I think a good way to start off is to shadow a dentist, see what they actually do in a day, and maybe write down some of that stuff, compare it to some of the qualities you have, some of the experiences you've had, and just really formulate those ideas in your head before you come. Because essentially the questions they ask are just to extract that information from you. So if you've already thought about that already, it's a very straightforward process.
Definitely. Sorry, I was just going to say, like you said, it's not necessarily looking at, to summarise all of your knowledge of the mouth and the teeth, and we're going to see your academic score for that. It's really an opportunity for us to see more of who you are as a person. Does that help? Amazing, awesome. I think there was one, yes, there, perfect.
Sorry, can I add to that?
Oh yeah, sure.
Answer? Yeah.
Sorry,
adding on to what everyone said, it's pretty much working smarter, not harder. So, during year 12, I saved up for a webcam to put on my laptop, so the quality would look nicer during the interview. So it's how you present yourself, and I pretty much learnt that from shadowing a dentist as well throughout high school, seeing like how they present themselves and how they communicate with patients, and transferring that to the interview. Yeah, I hope that helps.
For sure. Sorry, hello.
Quick question regarding oral health. What is their scope of work within patients? Is it completely different to a hygienist? Is that?
Yeah, it's a good question. We provide this, originally it started as a combination of dental therapists that did the full range of care for children and adolescents up to the age of 18, and then combined with a hygienist doing periodontal care. We're still in the final approval stages, but looking at having that extended to provide simple restorative care on adults as well. So you actually can do across the age range, full examinations, treatment planning, restorative care, and periodontal health promotion preventive aspects. For adults, it is not including the complex restorations or any of the specialty areas. So it's really looking at that more general care for children and adults rather than getting into the complex aspects.
And so that's why the 2 degrees, like we've got the 5-year degree, so what the dental students then learn are the more complex sort of dental procedures, and also managing more complex, say, dental problems. But within a team, like in lots of practices, there will be teams of like dentists, oral health therapists, and then dental specialists, either sometimes within the surgery or, they refer, and so there's like cross-referral. And that's why also, it's sort of, in 5 years, it takes longer for our students to cover some of the more complex sort of procedures, and working with more, and both the oral health students and the dental students do work with patients who are more medically compromised, but it's just the scope is just varies between the two.
So what about basic fillings and stuff like that?
Yes, that's right. So you can do, potentially once we've got the final approval, you can do all of the restorations for children up to the age of 18, but with the approval, we'll be able to do what we would call simple restorative on all ages.
I think also in terms of looking at both of them, like it's building on what the students said about shadowing, and both Jen and I would agree. So whilst you might not get an opportunity to actually directly observe, so that's another, shadowing is like observations, it's really important that any of you interested in both either dentistry or oral health to really find out what is the career involved, what are the sort of positive aspects of the career, what are the more challenges aspects of the career, what does each of the members of the dental team actually do. And maybe, again, there's YouTube videos, so if you don't get opportunity directly, you can call practitioners, your own dentist, or the staff that are working within the team, and each of you have your own attributes and strengths, And sometimes it might lie in maybe a shorter degree, you know, sort of confined to sort of this sort of area of healthcare. Others might be more interested in like sort of more expanded scope. Or then there's medicine, or there's nursing, or there's so many, because all of us are want to help people. Most people say they want to help. They do it because they like studying, they like the sciences. But then you have to think, you know, are you suited to that sort of career? How long do you want to spend studying? What type of sort of career do you want afterwards?
Definitely.
And they're both flexible, so you know you can choose. If you don't get in straight away, there's other pathways to get in. Both Jen and I have seen lots of our graduates come in with multiple different ways of entering the program.
Definitely, yeah. I think that's really good advice. I did see a hand, at the back.
Sorry, is there a way to like broaden up the scope for oral health, like for further studying, besides like just going to the Bachelors of Dental Surgery?
Like further study opportunities or like specializations?
Yeah.
I don't know if you have any insight, into...
So you can't go into specialisation as in, endodontists or orthodontists, but you can go and do further study where you might go into research, you might go into policy area. People will go on and do honours, do masters, do PhDs where they want to be more involved in research, but it's not specifically specialists.
And what I mean is like about crowning and veneers kind of thing.
Yeah.
Right, so that's in some of the specialist areas. So we don't do crowns and veneers. We do what we call stainless steel crowns for paediatric, but that's more temporary, but not on the permanent teeth. That's more in the specialist areas.
So if someone is interested in that range of dental treatment, or especially the pathway would be, if say you were doing a BOH and then you're interested in that, you would need to do a dental degree and then specialise.
Again, going back to your point about understanding the differences and picking
So you
what's
need to
right
pick
for
the
you.
right pathway to enter depending on your aspirations, your sort of, what you want out of the careers.
Definitely. I'm actually going to wrap it up there because we are unfortunately out of time, but I would like to say a massive thank you to you all again for spending your Tuesday night here with us, for answering all of your questions. I hope that you found that insightful. I hope that answered your questions. I would recommend go to the admissions guide, have a read through tonight. If you did have a question that we perhaps didn't get to answer, again, recommend get in touch with the Future Student Inquiries team. They are super, super helpful. But otherwise, we wish you all the best with the rest of your education journey, regardless of where you are, what year you are in. Hopefully we'll see you all at Open Day, and safe journey home to you all. Thank you so much.